Well, good afternoon, everybody. Thank you so much for joining our town hall. I think Rachel is in charge, so I'm gonna ask her if she thinks we should get started if we have everybody that we need. But I just wanted to, again, tell you guys how much we appreciate you joining us this afternoon and evening. Hopefully this will give you a good overview of the program here at the University of Colorado. And also give you plenty of time to just interact with the residents and get the real details about what this program is like on a day-to-day basis.
Yeah, thanks for joining, everybody. I think we're ready to get started. We're still waiting on a few presenters, but hopefully they will arrive before it's their turn.
Sounds good. And we want to be respectful of everybody's time. I know between the coast, this can be either really late or a little early and just before dinner, depending on where you are. So we want to make sure you have lots of good time to ask questions and we don't keep you too late. So this is just a picture of our current resident class, including our interns. And as you can tell, for the most part, they're a pretty smiley bunch, which I think is a great sign of how much they really enjoy being with each other and hanging out both together in the hospital, but also outside of the hospital. In terms of our faculty, Dr. Meacham is our chief of urology. He's been here for over 20 years and actually was the residency program director before I was. He provides sort of a unique perspective on the program because the program has grown literally, I think, 400% since he started. He sort of leads our infertility efforts at the hospital and also has had quite a few leadership and administrative roles, both locally at the hospital, as well as through the American Urologic Association and the ACGME. So he sort of is an expert on all things urology. This is our residency program team. Lucky for me, this picture was taken a few years ago before I had a baby and was tired all the time. But I'm the program director, Vijay Vemulakonda. Amanda Garza is really the backbone of our program. She's our program coordinator and is the person that keeps us running. If you guys do apply here, you will get to know her very well because she kind of mans interviews and the whole process to get from application to sort of match day. And then Simon Kim is one of our uro-oncologists at the university. He's our senior associate program director, and Tai Higuchi is our other associate program director, and he oversees a lot of the work with the gender affirming program at the University of Colorado and is one of our reconstructive and neurourologists at the university. Our faculty is quite diverse across 4 hospitals. And as you can see, we really have somebody that's been fellowship trained in pretty much every area of urology. And I think that really helps to broaden the experience. One of the other things that's nice about our faculty is that most of us have trained in a pretty wide spectrum of places. So we all bring slightly different perspectives, even within our subspecialty area of expertise. So you're going to get sort of exposed to lots of diverse perspectives that will hopefully help you build your armamentarium of resources as you're getting out either for fellowship or for practice. This is just a schematic of the Anschutz Medical Center. And you can't quite tell here, but what's important is this is the university hospital, which is right next door to the children's hospital, which is right next door to the VA. So 3 of our 4 main campuses, or 4 main hospitals are all on the same campus, which I think is really helpful. Again, our sort of flagship hospital is the University of Colorado, and Simon Kim is the site director there. About half of our residents rotate at this hospital. I think it's about 7 of our 15 residents are on rotation or on service at this hospital. There are 2 services, a reconstructive urology service and an oncology service that sort of work in tandem. So you really kind of get focused experience with a handful of faculty either on the oncology or the benign urology side during the course of your time. Children's Hospital, which is where I'm located, the site director is Kyle Rove. We do have 1 fellow a year at the Children's Hospital, and our 2nd-year fellow actually acts as a junior attending. So it allows for some sort of peer mentorship between the residents and the 2nd-year fellow. Currently, there are 7 faculty members here, including a full-time transitional urologist who just joined us this month. One thing that's sort of unusual about our program is that our surgeon-in-chief of the hospital, as well as the chief of pediatric urology, is Dr. Duncan Wilcox, which again, I think provides a unique perspective in that we have a urologist that's really overseeing all of surgical services at the Children's Hospital. And we have a pretty big population. We have a fetal center, so we see a lot of prenatal referrals for complex disease, sort of through the lifespan to adult urology, with both a benign transitional person as well as a uro-oncologist who's also trained in pediatric urology that specializes in adult and young adult cancers. Sort of our third hospital line is Denver Health. This is really our safety net hospital and is the one hospital that is not on the Anschutz campus. It is more in sort of the downtown Denver area. Dr. Donalicio da Silva is our interim chief and our site director is Fernando Kim. They do a large amount of the stone work that we do in our program, as well as quite a bit of prostate surgery, including things like HoLEPs, as well as quite a bit of advanced laparoscopic surgery. And that sort of is Dr. Kim's area of specialty or expertise is laparoscopy. So you kind of get a fair amount of minimally invasive surgery, despite the fact that this is really a safety net hospital. They also have a large gender affirming program that they've developed, which I think is relatively unique for a safety net hospital. And so that provides an additional experience and exposure to gender affirmation and pretty complicated reconstructive surgery in general. And then our last hospital is the Veterans Affairs Hospital, which you can see in the picture here. This was a labor of love to be built. I think the goal was a 5-year build. It took about 13 years. I know that when I started here 11 years ago, they told me it would be finished any day now. And it opened up, I think, 2 years ago. Mark Sawyer, who's one of our endourologists, is the chief there. And our site director is Granville Lloyd, who I think will speak a little bit later this evening and knows everything Colorado and everything Denver, and has really been a wonderful resource, both as a mentor and an academic urologist who does quite a bit of research, but also clinically. And he really has spearheaded the robotic surgery program that's at the VA. In terms of research, we have pretty robust research here. We have 2 full-time PhDs, Anna Malakina, who's pictured here, and Allison Shee, both of who have R01 funding, and their lab primarily focuses on benign urologic disease and bladder pathology. There's several of us who also have extramural grant support and are always looking for people who are interested in research. When it comes to actual research infrastructure, there's several sources for research support. At the Children's Hospital, we have PURE, which is the Pediatric Urology Research Enterprise, and I actually oversee that group. It consists of a program manager, 2 research assistants, including a 1-year medical student research fellow, as well as statistical support, resources from everything to how you get training to be able to submit something to the IRB, to how do you develop a REDCap database, to how do you develop and use electronic health record-based tools to complete your research. We have a pretty large kind of a group of medical student trainees that volunteer with us. And so there's always help for projects as well. So if you take something on, we can usually find a medical student that we can match to your project. Additionally, there's a clinical trials office in the Department of Surgery. They primarily work at the university, but can help with any kind of clinical trials, whether those are industry funded or PI initiated. And actually, Dr. Rodriguez Pessoa, one of our chiefs, worked with the clinical trials office to do a pilot study during his research rotation. We have SOAR, which is basically a surgical outcomes group that focuses on health services research that has a full-time PhD statistician as well as additional statistical and analytic support. They do a monthly works in progress meeting and have access to large databases, including NSQIP, VASQIP. I think they have access to Medicaid claims data, so some secondary administrative database resources through that. And then within the division itself, we recently instituted a research tax for all faculty and have utilized that funding to support both PRA and statistical help within the division directly. And the hope is that we'll be able to continue to expand those resources, and those will be all of those resources that are listed here would be available to residents in the program. The research rotation itself consists of 2 2-month blocks in the PGY 3 year. I oversee this process in my role as the director of research. And so I'm a little bit OCD. So I meet with all of the residents at the end of their second year to make sure that they've identified a primary mentor and are working to find at least 2 projects, as well as a quality improvement project before they start the rotation, so that they can actually get IRBs together and be in the process to hit the ground running when they start their research rotation. I actually require the residents and their mentor to sign a contract stating that the mentor will meet with the residents on a bi-weekly basis, and also including a list of projects where the resident is expected to be primary author. And then I try to meet with all the residents at the beginning and end of each block just to troubleshoot any issues that might have come up, help to provide resources if needed, so that if they run into any hurdles their first 2-month block, we can hopefully overcome them before they start on their second 2-month block. In general, the residents are expected to have at least 2 projects as primary author, with a goal of submission of those projects both to a regional and national meeting, as well as for publication. All of our residents present on sort of a research grand rounds at the end of the research year. And I have to say today, our residents have widely exceeded these expectations. And I'm always amazed by how much work they're able to do with such a small amount of truly dedicated time. And this is just sort of a summary of all the productivity of our residents and over the past 9 years. Just looking at this meeting, we've had multiple residents that presented at the AUA. Many of our residents are going to the South Central Section Regional meeting this week to present their research, as well as residents who've had work accepted to the pediatric urology meetings, SUFU, so for female urology and reconstructive urology. So really a wide array of meetings. And the goal is really to use these presentations as a way to help position our residents for their career, whatever that might be. So if you're interested in fellowship, we want you in pediatrics, for example, we want you at a pediatric meeting so we can introduce you and make sure that you're getting the visibility that you need as you're going through that fellowship match cycle. That's sort of a brief overview. This is just a picture of last year's class for Movember. As you can see, some of our residents rock a mustache much better than others. I can see at least a couple maybe on the Zoom that might be working for Movember already here. So we'll turn this back over to Rachel. And I think, I'm not sure who's on the call. I think maybe Dr. Lloyd is on the call to talk a little bit about the BA next. And I'll stop sharing my screen.
Yeah, that would be great. Dr. Lloyd, if you're ready, you should be able to share your screen.
I think we're going to have Dr. Wilcox go. This is Dr.
Perfect.
Gicci, and then it was going to be Dr. Lloyd, Dr. Thurman, and Dr. Kim.
Excellent. This is why we have multiple people that oversee the town hall, so we can keep everyone on track. So we'll turn it over to Dr. Wilcox and Dr. Rowe from Children's.
Are you able to see my screen yet?
Yes, we can see your screen now.
Okay. Okay, so I'm going to talk a little bit about Children's. Children's is on the same campus as Dr. Vimalakonda mentioned as the rest of the adult hospitals, apart from the Denver Health. We're just a short walk from that University College Hospital. At Children's, there are currently 7 faculty. I just briefly go through them for you. I obviously trained in the UK and have an interest in reconstruction, but also standard bread and butter pediatric urology. Jeff Campbell trained in Houston and has a specific interest really in stones and does a lot of work in our DSD clinic. You've met Dr. Vimalakonda, who has developed a big research interest and an interest in congenital kidney and urinary tract problems. Nick Cost trained in Cincinnati and did his residency in Dallas and has developed a fairly unique practice in pediatric and young adult cancer work. Brian Caldwell actually trained with us here, having done his residency in New York, and actually works mainly at our Colorado Springs hospital, but comes up to the Denver hospital probably once or twice a week. So you do work with him, but he works mainly in Colorado Springs, where you don't have to go to your residency. Dan Wood has just joined us. He also trained in the UK and has a real reputation for transitional urology, and will be working half his time here at Children's and the other half at the university to ensure our complex patients get suitably care as they go into young adulthood and adulthood. And then Carl Rove trained in St. Louis, having been a resident with us here, and has also developed an interest in reconstruction and enhanced recovery after surgery, and has a quite unique exposure, or give you a unique exposure to clinical informatics, as he's our surgical informatics lead. We, as you can see, we have 7 attendings, 5 nurses, 5 advanced practice providers, 2 physical therapists, a psychologist, a number of schedulers, and a manager. And the reason why I bring up the schedulers and the managers is because they do ensure that a lot of the sort of administrative work is done for you. So organizing cases, apart from emergency cases, clinic visits, that sort of thing, are done by us. We have a clinical fellow, as Dr. Bimalakonda mentioned earlier, and then they transition to being a research fellow and also a junior attending in their second year before they go on. You come to Children's as a Euro 2 for 4 months, and then as a Euro 4 for 4 months. And when you're here as in your 4th year, you act as a sort of chief. It's the first time you act as the chief, with the fellow acting over you as a sort of consultative service, which I think provides really good experience for you in behaving as a chief. So Children's is a good rotation. I think the reason for that is that we are really interested in education. We are busy, but not so busy that you don't have time to read and really understand what we're doing. We have 2, in addition to the main site here, we have 2 off-site ambulatory surgery sites which you can come to, where we do more of the bread and butter work, and it's extremely pleasant. We have 2 hours of dedicated education for pediatrics every week, in which certainly one of those hours is definitely concentrated on ensuring that the residents get a really good education. The second hour is more varied, and obviously you'll actively participate in that. You know, I think one of the reasons why this is a good place to train is that we have a very large surgical volume. We do well over 2,000 cases and see well over 10,000 patients. So even though we have a fellow, there's a lot of opportunity for you to work. In fact, it's not uncommon for us to have operative days that go without a resident, because we have other operating rooms going. We're definitely interested in teaching, and I think that is spelled out by all of us. And we have a lot of research opportunities. 2 of our attendings, Dr. Bimalakonda and Dr. Cost, are 50% protected or more research time, and a number of others are very interested in research. There are a lot of projects, both research projects and quality initiative projects to go around. In addition to general pediatric urology, Nick Cost is a member of the Children's Oncology Group, so it gives you an interesting exposure to the sort of work that gets involved in organizing complex multi-institutional care. Carl Rove is the clinical informatics for the whole of the surgical section here. As Dr. Bimalakonda has alluded to, we have a very active research program with 2 NIH-funded faculty here at Children's and an NIH-funded PhD that are involved both in local work, multi-center work, and we have a multidisciplinary collaboration in almost every area, from fetal through stones, through colorectal, through neuropathic bladder and spina bifida. So we have a very broad array of topics. So if you want to do pediatrics, we can certainly give you a really good training in that. And if you don't want to do pediatrics, we know we can train you up so that if you do go to a hospital that has a need for an adult urologist to do some pediatrics, we can certainly train you to do that. And we have lots of ex-alumni who are doing that. So thank you very much. I know that was a whistle-stop tour through children's, but if you have any questions, I'd be very happy to take them now, or at the end, one of us can take those questions, or if you develop questions later on, I'm very happy to have you contact me through my email or through Dr. Bimalakonda. Happy to take questions on chat too. Okay.
Thanks so much, Duncan. I think we're going to hand it over to Dr. Lloyd next. Is that right, Ty?
Yes, Dr. Oh, sorry, I'm still on the Death Star.
Yeah. Right here. Sharing actively. Here we go.
And as Dr. Wilcox mentioned, there will be a little bit of time at the end for questions for the faculty before the faculty hop off the call to let you talk with the residents as well.
Okay, is that projecting right?
Looks good, Greenville, thanks.
You can hear me, great. Thank you all so much, both for the chance to talk and for coming to learn a little bit about the Rocky Mountain VA and especially just the entire University of Colorado program. It's such a good program, and it's really both an honor and a privilege to be here. And it's fun to talk about. We'll keep this short. I mean, I think what you're really here to do is talk to the residents, get the scoop, and kind of ask the what's it really like questions. But I'm going to try to just roll through the VA at high speed. So in my opinion, you know, and the advice I would give you as applicants today, there's about three things that you really want to pay attention to. Number one, and the reason that you're looking at doing this is to get good training. And that can mean a lot of different things, and that can be and will be in our institution tailored to what your goals are, be that academics, be that fellowship, be that private practice, be that to develop excellent clinical skills, which you will, to develop research skills and those sort of opportunities, which you will, to understand how to go about conducting research, you know, all the different facets of pediatric and adult urology with or without academics that you'd like to learn about. Secondly, you know, will that training provide you, and will this institution provide you with the opportunities that you want? Will you be able to get the fellowship that you want? Will you be able to get the job that you want? Will you be prepared to do the job that you ultimately want to get to? And the answer, I think, is overwhelmingly yes to that as well. We have all three graduating chiefs this year going on to extremely high-powered and outstanding fellowships. We have a lot of graduates in the past that have gone on to fantastic private practice opportunities and have felt incredibly well prepared for those things. But again, I'll kind of let everybody else provide the best answers to that. The one that's kind of the most ineffable, I think, feature of residency and training, besides the fact that y'all know, which is that it's really hard, is it going to be the sort of situation that you're going to be happy in? Is it going to be the kind of place that you enjoy being? Is it going to be an environment that allows you the best chance to get the good training and to develop the skill set and to move on, hopefully with lifelong friends from it? And I'll try to give you the spin on how that is for our residents here. So the VA, a couple words about it. It is, in fact, the 26th most expensive building ever created. I think my video shows me hovering above it in some kind of like helicopter or something. $1.7 billion, which is just stupendous. The elevators still break, so don't think there's anything special going on the inside. In contrast, for 1.7 billion instead, you can get all these kind of things because that's what Yankee Stadium actually cost to build, if you can believe it. I think their elevators are broken too. This is us. Mark Sawyer is our chief and king of all these surveys. He's fellowship trained in urology and general urology. Steve Steinberg brings all the talent, knowledge, wisdom, and humor of a, been at it and been really good at it for a really long time. Urologist. Whoops. That's me. And then Dr. Eric Byland that just joined us recently from University of California, San Diego. Super well trained, wonderful guy, tons of horsepower. Just an incredible pleasure to have him with us as well. A little shot of our crew here, probably about a year and a half ago. Being at the VA, our goal is for it to be a good experience. It's got a lot of leadership opportunities, both for the junior residents and for the chief residents. We really envision it as being a resident-run service. So during your time here, we're here to help, to support, to do everything we can to ensure your success. But at the same time, we kind of want to give you a lot more of the reins to the horse to ride around and do things. We do pretty much everything that there is to do robotically, from some kind of weird spermatic cord things to intracorporeal urinary diversion to simple prostatectomies and reconstructive robotic urology. We're doing a ureteral reimplant on a duplicated system after cystectomy tomorrow. Should be a hoot. We do a fair amount of open surgery. There's no doubt that the robot replaces open surgery to some fair extent, but there's still tons of things that come out. We're talking today about booking a concomitant XGP nephrectomy with a Whipple. I don't know if we're going to actually do that or not, but open surgery comes along, and we did a big rectovesical fistula open repair, some large mass today. So there's plenty of just great VA pathology in every direction. We are amazingly, and I'm just going to brag about the institution as a whole, the program as a whole. We have 3 people at three of the different, all of the adult hospitals that do HoLEP, which is super cool and pretty rare to have 3 of these kind of what I view as kind of magicians. They stick this little thing in there and wave it around, and the orange pops out or whatever this graphic represents. But we can get HoLEP experience for y'all at every institution. This is an open bladder augment we did a couple months ago now. We've got, because the VA does still come with some amount of time. So we've developed a few educational sort of clinics and meetings that we have. We have a video review session that's, I think, not listed here. Renal mass work group. We got a prostate cancer MRI program that is, I think, recovering from COVID itself now. And we do lots of other things. We're a regional spinal cord center. We have simulation equipment, et cetera, et cetera. So, we have so many things, both program-wide and also at the VA. It's really a bit of a buffet table for the rotating residents to hopefully choose what they need, what they want, what they desire, what prepares them best for their futures. And we work as hard as we can to craft that. We do all kinds of research. We've got some more publications that have come out since I put this slide together last. That's a pig bladder getting measured in the left side there. So don't mind the obvious lack of sterile technique. But more than anything, my advice again to you guys is, find a place where you feel that you're going to be happy. The people that you work with, the corps d'esprit, the work ethic, the just global happiness, the willingness to help each other that residents bring to each other is incredibly important to how you're going to enjoy the next number of years. I'm here to tell you, having been between fellowship and residency and so on and so forth, affiliated with a number of different programs, this program absolutely excels in its ability to put people together and for them to just kind of continue to thrive on this culture of mutual support and affection. And I think it really, not to take away from its hard, but everybody gets through it with a smile, or at least they look like they're smiling. A few fun pictures. This is a resident ski day and or group ski trip. Reproduction seems to be a big theme in the department lately. Miguel on the right just got engaged lately. And I think Jeff's got number 2 on the way. I honestly get confused, and I'm embarrassed if he's listening that I don't know the exact answer to that. He's one of our chiefs, Jeff Morrison on the left, headed to UCLA to do men's health and infertility next year. There's things to eat and drink in the Denver area. Enough said. Golf. Don't let the fact that these guys look like they can play golf confuse you into thinking that they can play golf. That's probably not the case. Fun pictures in the grass. pool, skiing. You know, the take home point from this, that's Mike Atwell about 3 days ago doing some kind of surgery on the pool table on the right there, is, you know, it's not as much the content, it's the camaraderie as another resident ski day shot. And I think it just makes the point that everybody gets along well, works well together, plays well together, and is at least able to get out in actual ambient sunshine and have a photograph taken a few times a year. Via's everywhere too, which is awesome. This picture ought to be a stamp. I'm seriously submitting this to the Postal Service. A couple attending shots. We get out and join you guys as well whenever we can. Golf day, ski day, you name it. Couple quick words about Denver and then I'll move along. It's an awesome city. I grew up in a little farm town about an hour north of here. And Denver has become so cool, I can barely stand it. Union Station downtown is just a really neat place and a lot of surrounding fun things. Ballparks right nearby. The restaurants and so forth are extensive. This is the last time this place was not packed to the ears. It's kind of near where I live. Red Rocks, if you're in the music world at all, you've heard of it. I hope you've been. If you haven't, you should go there. It's unbelievable. You know, I don't want to go too far into the ski bike, you know, run, climb world, because there's unbelievable art opportunities. Only 2 places, I think, in North America hosted this Monet exhibit. I went to it and it was just absolutely stupendous. So, you know, Denver is a large city. Same thing. There's a lot going on in every kind of way. The food scene here is super interesting. And there's just so many new experimental things popping up. Yoga at Red Rocks, done this. It's unreal. Watching the sunrise, getting your down dog on. And then, of course, there's the mountains. These are a couple of my pictures just from camping and biking and such. It's really hard to go wrong up there. It is hard to go wrong in traffic on I-70, but we can talk about that later. And finally, we have great food access at the VA. It's not just that dude Van right in the center picture there. He makes the sushi at the VA. Lately, he leaves at like 11:30, which just crushes my soul. But you can still get genuine, non-toxic sushi at the VA. And all these things are about 300 yards away across the street, and pretty much everybody runs over there routinely for it. Another group shot of our happy posse. This was Ugly Sweater Day. I'm gonna say, obviously. And the best thing not to miss, for those of you that have, and those of you that have not worked at a VA, there is nothing, I think, better than taking care of the veterans. They are the world's most appreciative and the world's most adorable patients. And if you don't look at this picture and say, I really want to provide urologic care for those two, then you may be considering the wrong application. The veterans are just the greatest thing. They're challenged, they're sick, they need our help, and they appreciate it. And they're also tend to bounce back from things that you wouldn't expect. So just in summary, the things you care about, that's Dr. Brian Landa writing into the sunset there. Again, you know, will you get good training? Absolutely you will. And I think everybody will agree with that. We get the opportunities after residency. I'm here to tell you that you will. And finally, I think that our culture of supportiveness, encouragement, and helping each other out really provides just the perfect mix for everybody to be happy during this, you know, admittedly hard period of life. Shoot me an email if you have any questions or call or anything. I think the residents will be there to answer it all. And thanks again so much for your time.
Thanks so much, Dr. Lloyd. I think next up is Dr. Thurman to talk about Denver Health.
Hello, everyone. Okay, my name is Carrie Thurman. I am an associate professor here. I recently moved from the University of Kansas and am working at Denver Health and want to talk to you about our experience here. So Denver Health is Colorado's safety net hospital, and we deal with the special populations, the poor, uninsured, homeless, victims of violence. We are a level 1 trauma center and see a whole lot of trauma compared to where I came from in Kansas City. We have surgical subspecialties here, as you can see, and one of the highest trauma survival rates It is not uncommon here to see a lot of GU trauma, fixing gunshot wounds to the bladder, ureter, a lot of renal lacs, etc. We have 3 full-time urologists, 3 full-time APPs, a dedicated OR team, and a research team. Here are our nurse practitioners and physician's assistants, Beth, Shaheen, and Ian. They're amazing and really provide a lot of continuity of care here at Denver Health. And then here are your urologists. So Fernando Kim, he is really the heart and soul of Denver Health. He has been here for 20 years. He is a fantastic surgeon. He is trained in pure lap and is just a magician. So we do not have a robot here. So you will do a lot of pure laparoscopy, which is fantastic. Dr. Donalicio is our interim chief. He has been here since 2013, and he does endourology, trauma, reconstruction, and gender reassignment surgery. I just joined here in May 2021. I am a general urologist and specialize in voiding dysfunction and do holmium laser enucleation of the prostate. There are so many big prostates here, and we are having a ton of fun learning HOLUP. And I'm teaching partners and as well as the residents. So scope of practice, oncology, endourology. Dr. Donalicio gains his own access and will teach you that as well, and does mini PCNL. And we are currently doing HOLUP, trauma, reconstructive surgery, and general urology. Our focus is really on minorities. Again, we're a safety net hospital. This is a fantastic place to train, not only for the pathology, but for the social aspects of care and really helping you broaden your scope of practice. We have a new outpatient center where we see our patients. It's really beautiful. We do transperineal prostate biopsies, cystos in the clinic. We have fluoro in the clinic. In terms of resident education, we have a PGY4 and an intern here at all times. And so my main focus is to really work on the PGY4's teaching skills. And so that is something that I focus on in the operating room. So I do an evaluative process of the PGY4 as a teacher, of the intern, which is really fantastic. As interns, you will have so much experience here operating. You will do cystoscopy. You will do ureteroscopy. You're going to put your foot on a 100-watt laser. And I think that is such a special part of our program. An aside, I am a certified professional life coach, and I really enjoy meeting with all the residents for coaching purposes. And again, that is a passion of mine that I'm so excited I get to do here. If you have any questions, please email me. I see some of my former students from KU on the call, and it's really great to see you guys. Thank you.
Thanks so much, Carrie. And I think one of the things that Carrie mentioned that can't be emphasized enough is Denver Health is a place where I think you feel like you're really giving back to the community. You see people that speak a million languages, and really come from diverse cultural backgrounds, in addition to sort of diverse socioeconomic status. You see people that come from the mountains after a ski injury to somebody who may be a first-generation immigrant who comes with metastatic cancer. And I think that sort of is part of the mission of our program, is we want people that feel comfortable working with and treating diverse patients from the whole spectrum of populations and every sort of socio-demographic group. And I think this is really a unique opportunity that Denver Health provides. The last hospital that we want to talk about is the university. And excuse me, Dr. Higuchi, I'm not sure who's presenting for the university. Do you happen to know who's up next?
Dr. Kim said he's logging on.
Okay, so maybe we'll
a few questions while we're waiting.
Yeah, so maybe we'll wait for Dr. Kim. Do people have any questions at all about the program that we can answer for those of us who have already presented about research, about the overarching program, about any of the hospitals that you've heard about that would be helpful? I know it's hard. You all want to ask the question at once, but I promise we'll take you in turn. So don't hesitate to just turn off your mic and chat.
Yeah, I would ask you, you alluded to the diversity of different patients that you see. I'm curious what I'm not holding you to this or expecting an exact number, but I'm curious what you would estimate the demographic backgrounds are in terms of percentages. Is like half of your percentage, or is half of your population, patient population, white or non-white, or like what? Just curious, like how much diversity you do see.
Yeah, so if you look at the Colorado census, we're about 75% white, with our largest minority population being Hispanic. But I think that underrepresents the Denver area. So there are pretty large refugee populations in Denver. We have a large population from the Central African Republic. There's a large Hmong population from Myanmar. We have populations of refugees from many Southeast Asian countries. I think we have a Vietnamese population that's pretty big. There are small enclaves of Middle Eastern families and Indian families. So there's a fair amount of diversity, but the numbers are fairly low. So like I said, I think it's about 25% overall in the state of Colorado. Dr. Thurman, you may have a better idea at Denver Health. I think Denver Health skews a little bit. At Children's, we cover a 7-state catchment area. And so our numbers are actually a little bit worse in some ways. So we have about 80% white children and 20% minority, but our socioeconomic status in rural versus urban is much more diverse than sort of the central Denver area. And so I don't know, Dr. Thurman, you have thoughts about the population at Denver Health?
Yes, at Denver Health, 70% of our patients are non-English speaking as their primary language. Most of those are Spanish, but today I had, for instance, Cantonese as another language. So very common for us to be using interpreters, or many of our residents and faculty speak Spanish.
Anyone else have a quick question before we hand it over to Dr. Kim to talk about the university?
I would love to hear more about the gender affirming care and how much exposure residents get to that, and maybe just some details.
I will hand that over to either Dr. Donalicio Da Silva, who I think is on the call, or Dr. Higuchi. I think they both are on the call. Dr. Donalicio Da Silva, do you mind chatting a little bit about the gender affirming program at Denver Health?
Well, while he's waiting, I can talk about the university's program. And so our program's about 2.5 years old, although we're only about 1.5 years into surgery due to this, thing called the COVID pandemic, which shut down elective surgeries for a good year. So basically we do the entire spectrum in conjunction with plastic surgery of vaginoplasties. Sorry, I didn't realize my video's off. So we do vaginoplasties, which include, what's called a minimal depth vaginoplasty, all the way to, we do a peritoneal flat vaginoplasty. And then we also do phalloplasties, including ALT flaps, radial four flaps. And those are kind of the main procedures we do. As far as resident exposure to the gender affirming surgery, they're actually some of the best anatomic surgeries you'll see, just because the ability to see how you can take a cisgender male's, basically the cisgender male penis and turn it into a vagina is pretty amazing. And you also learn where all the nerves are. So definitely, I think the residents have become much more engaged in that when they've seen the opportunities. There's also, on the robotic portion of the procedure, there's a lot of sewing robotically. And so there's always something to do, like not only for me, but for the resident, for our fellow, because there are a lot of steps in that operation. And then lastly, we do have a combined clinic with plastic surgery, endocrine, psychiatry. And the residents have not classically come to that clinic yet. And I just say that because it's a newer clinic and it is just filled with so many providers. It's an overwhelming situation to begin with. And so we haven't quite determined how we can integrate the residents into that.
Dr.
Thank you so much.
And I don't know if Dr. Alicia De Silva has anything to add. I thought I saw his face briefly a moment ago. I think you're on mute, Rodrigo.
Better now? Okay. So the transgender program at Denver Health is in combination with gynecology. So there is primary care and endocrinology doing the medical part of it. And the surgeries, the genital surgeries are done by gyne and urology. And plastics is doing the top, ENT doing some of the face and tracheal shaves. So there is opportunity for the residents to participate if they are interested. It's not like a requirement for the residency that they scrub for these cases. We are seeing an increase this year of complications of surgeries done at other places coming to urology. So the reconstruction opportunities for transgender patients are increasing, and those are through urology clinics. So that for sure will be something that they will have exposure.
And then just the last thing is, as Dr. Wilcox mentioned, we have a really robust differences of sex development program at Children's, and we probably do less surgery than the adult transgender or gender affirming programs do, but you see quite a bit of pathology kind of along the spectrum of DSD in a multi-center clinic. We have partnered with sort of advocacy groups, so we actually have patient champions who are adults who have DSD conditions that actually are part of our clinic and help with support for families and discussion of sort of these disease processes over sort of the lifespan. With that, I'm going to hand it over to Dr. Simon Kim to talk about our last hospital, the University of Colorado Hospital. So Simon, I don't know if you have slides to share, but hopefully you can share your screen.
Hi, I'm Simon Kim, one of the Associate Program Directors and a urologic oncologist. Can you guys see the screens okay?
Yes, thanks.
Perfect. Sorry, one of the former residents is texting me about a question for a patient. Sorry about that. So I'm Simon. I specialize in urologic oncology. I was going to talk about the university service. Probably one of our busiest services in our training program. So the University of Colorado Hospital is a pretty big hospital. We have 690 beds. There are 38 operating rooms. We do have 3 Da Vinci Xi robots. There is a talk or process potentially getting the single port robot. We do roughly about 3,000 cases per year, 150,000 ER visits, 1.3 million outpatient visits, around 50,000 admissions, and a fair amount of organ transplants. Essentially, we broke the team up into 2 groups. There's Team A, which does recon, which I'll talk about shortly, and Team B, which I'm on, is oncology. They're formally named after 2 large mountains, 2 14ers, but we changed that. And so for Team A, I would argue that we probably have one of the leading programs in the country, led by Dr. Flynn and Dr. Higuchi. They both do high volume, complex recon. I've been a faculty at other places, and they're doing really complex robotic recon, as well as gender affirmation. Dr. Oliver does female pelvic floor surgery, and she's fantastic. She's UCLA trained. Dr. Meacham is specializes in infertility and is our chair. We also have 2 fantastic fellows, Alexandra Berger and Maggie Higgins. They're really great to work with. And the fellows are really integral in terms of resident education and teaching. They're really great to work with. The fellow last year, Kurt Rieger, was fantastic. He's at Kansas and, essentially ran his own room and would work well with the residents in terms of education. Vera is our fantastic advanced practice provider. She helps with the floor in terms of discharges, drains, and helping the residents get to the OR. So she's really fantastic and been really just a great addition. And for Team B, which is oncology, we have Dr. Barkawi, who focuses really on sort of focal therapy for prostate cancer. Dr. Maroney does a lot of prostate and testicular cancer. Dr. Koss does a lot of testis cancer as well as familial kidney cancer. Dr. Kurkrasia does a lot of the cystectomies. I do sort of the tumor thrombosis cystectomies and some prostate cancer. And again, I think for our service, along with Team A, we have an advanced practice provider, Brooke Greenberg. She's really fantastic in terms of, again, helping the residents get to the OR. They're really integral parts of the team. They're really a lot of fun to work with. Who rotates at the university? We have 6 residents, which is kind of broken down by the Team A and Team B services. So Team A and Team B each will have a chief resident. They will alternate with a senior resident, either going to Team A or Team B, and they're 2-month blocks, with 2 junior residents for Euro 3s and 1 Euro 1 resident. There's typically 1 intern who helps with consults during the day as well as floor activity, and then there are the 2 fellows. And here's sort of the breakdown again of the residents who per service in terms of the fellows, the chiefs, and the consult team. I will say, like, the residents here get a lot of time in the OR. They have really a great operative experience, robotically and open, for both reconstruction as well as oncology. In addition to the inpatient advanced practice providers, each clinic has outpatient advanced practice providers to help with follow-up. They're really great in terms of arranging for follow-ups for post-ops and seeing patients. They're really great to work with. Amanda's been here for many years. She does a lot of the stones. Abigail Webb is just recently hired and has been really just a great addition doing general urology. John Dodge, I would argue, is one of the leaders in men's health. He trained at Baylor and has just been really a fantastic addition. He, I would suggest, knows more about men's health than I do for certain, so he's really great. Shannon is our brand new hire, and she does oncology with us as well and has been really integral to care. Brianna Mitchell, we do have an MDC clinic, a multidisciplinary clinic for oncology. She's been fantastic about sort of arranging for these complex cases we get referrals for in terms of discussion about multidisciplinary care. So we do have some developments, and it's not the airplanes. We have a brand new tower, essentially, which is a building which will have brand new 9 new operating rooms plus 103 beds. This is much needed. We are very busy here at the university, and these brand new ORs and these beds will help also offset some of our ability to get more OR time. It is being built as we speak. Sorry, my computer's falling apart. And should be done by 2022. It's a very exciting time. When I signed, they had just started building it. So this is going to be a really great addition in terms of allowing us to get more OR time. In addition to that, the University of Colorado healthcare system is rapidly expanding across the region. We are the referral center for the state, and I would argue for Wyoming, some of Montana as well, and Nebraska. And so Cherry Creek Medical Center is our outpatient sort of flagship place. There are 4 operating rooms that exist there, plus clinic. Dr. Higuchi and Dr. Flynn are taking some of their complex recon cases over there to do sort of high volume cases. And so I think this is really going to be a welcome opportunity and a great experience for residents moving forward. Dr. Dan Wood is a recent hire. He is a pediatric urologist who'll be joining in the fall of 2021, like soon. He's a pediatric urologist and will be leading the transitional care from sort of pediatric to adult urology, and will be really a great addition. Super nice guy, and be a lot of fun. And we have a really great crew of residents. I do honestly believe there's a special sauce here at the University of Colorado. The residents are really fantastic to work with. I've been in faculty at other places, and it makes teaching a lot easier because they really do care for each other. They look out for each other. And so it's just really a pleasure working with them. It's been a lot of fun. Sorry. And that was my last slide. I'm happy to answer any questions about the university service. And thank you.
Thanks, Dr. Kim. We have about 5 minutes before we turn it back over to the residents and all of us faculty get off the call. Are there any other questions we can answer for you guys before we let you guys get the real scoop from our residents?
Hi, I'm Phil Woodruff. I was just wondering if someone could speak to the interaction between residents and fellows. I know having fellows, you hear sometimes about conflicts there. It sounds like that's not going on there, but if you could just speak to that, I'd appreciate it.
Yeah, we have two fellowship programs, the Recon Fellow and the Children's Fellow. I think what's nice is that for the Recon Fellow, they are actually attending for a large part of their time. So again, I think we see the fellows as a way to expand opportunities for peer learning. At Children's, with 7 faculty and 1 clinical fellow and 2 residents, as Dr. Wilcox mentioned, there's usually more cases to go around than there are people. And our fellows work on a sort of apprenticeship model. So they work with 1 attending primarily for 2 months at a time, which then leaves 6 attendings that are only covered by the residents. So we haven't had that be an issue. Our numbers for pediatric cases are well above 90 percentile in all pediatrics. So we don't think it hurts the experience at all. I would defer to our residents if they have other thoughts, but in general, from our perspective, we haven't seen an issue. And I don't know, Dr. Hughes, if you want to say anything else about the Recon Fellow?
Yeah, I mean, I think very similarly, our reconstructive fellows, they're instructors within the division of urology. So they actually will do some cases on their own that the residents cover. Last year, actually, the residents, maybe they like covering some of our fellows' cases more than with me, just because he was much more jovial and playful than sometimes we are. But I think, for the residents can speak more of this. I think Dr. Flynn and I both kind of take the approach of there are portions of a case, depending on your training level, where we want you to be involved in the case versus, the fellow needs to do that portion of the dissection because that's more something the fellow is going to do later on for the rest of their career. And so, different examples would be, like last Friday, I had one of our chief residents with me, and she and I started a urethroplasty together, got through to a certain portion of the case, and the fellow and I did the urethral dissection. And while the chief resident went and got the buccal graft, and then we all came back together and did, the remainder of the case. So, I mean, there's a lot of shuffling around in cases, but it is incumbent upon the attendings to make sure that the learning environment is, it's conducive for everybody that's involved. And like I said, with the transgender cases or gender affirming surgeries, there's certainly a lot for every level resident to participate in. So it's actually one of the more fun parts of our job is to have residents and fellows around.
I think we maybe have time for one more question if anybody has a question. And like I said, you're welcome to reach out to us outside of this town hall as well if any questions come up.
I had a question on just resident dedicated education. I heard Children's, they have a 2-hour a week meeting. Do you guys have where all the residents get together and have meetings every week? Is that something?
Yeah, we have grand rounds on Monday. So that consists of an hour of general surgery grand rounds followed by an hour of urology grand rounds. We then have Friday morning that's sort of across the department. We have an hour of urology grand rounds from 6:30 to 7:30. Followed by resident book club or sort of from 7:30 to 8:30. And usually the residents try to meet in person. They usually will get coffee or breakfast afterwards before they come back to the service. As you mentioned, Children's has a 2-hour teaching conference every Friday afternoon from 2 to 4. Additionally, I believe that Denver Health has a dedicated education conference. You heard from the VA, they do quite a bit of educational work there, and they have both a endo and a robotic trainer over there. And then Dr. Kukrasia and Dr. Lloyd, who I think have both been on the call, have actually done quite a bit of work in sort of developing a formal curriculum, utilizing the simulator to help with interns and sort of junior residents to work on their skills and really feel like they're slick when they're going into the OR to get a chance to operate. So we take education very seriously at this program and want to make sure you guys are getting everything from didactic learning with sort of a curriculum and reading assignments to training on hands-on training to opportunities to socialize with your colleagues and learn from your colleagues, whether those are the residents or the fellows. All right, with that, Rachel, maybe we'll get all the faculty off the call so you guys can hear the real dirt about our program, which hopefully isn't too dirty. So thank you guys again so much for joining us. We really appreciate it and hope to see you on Zoom or in person in the future as interview season gets going. Please, please don't hesitate to reach out if there's anything we can help with. All right, bye.